Good day, everyone. I'm Dr. Benjamin Xu, Director of the Glaucoma Service and Director of Data Science and Artificial Intelligence here at the University of Southern California, Roski Eye Institute. I'm excited to share with you our vision of how we will transform eye care using artificial intelligence and telemedicine. We are currently in the midst of an eye care crisis. It is projected that over the next decade, the demand for eye care services will increase by 24%, whereas there will actually be a 12% decrease in the ophthalmology workforce. This will lead to a shortage of eye care providers and more difficult access to care for patients. In order to address this eye care crisis, we here at the University of Southern California have founded the ATLAS initiative. ATLAS stands for AI and Teleophthalmology in Los Angeles. Our goals are to deliver eye care primarily to underserved communities, while also improving the quality and the equity of eye care. We also wish to enhance the efficiency and cost effectiveness of care overall. Our team is comprised of clinicians as well as data scientists and computer scientists from the USC Information Sciences Institute and healthcare administrators from the Los Angeles County Department of Health Services. Our disease of interest is glaucoma. Glaucoma is the most common disease of the optic nerve worldwide and is also the most common cause of irreversible vision loss. The optic nerve connects the eye to the brain and plays a vital role in sight. There are currently over 80 million people affected by glaucoma worldwide, and glaucoma detection is a major issue where more than 50% of patients with the disease are undetected and therefore untreated. Los Angeles County Department of Health Services has established a robust teleophthalmology screening program to address these issues in access to eye care. This program is located at 17 sites across Los Angeles County, and screening for eye disease occurs through fundus photography, where pictures of patients' retinas are taken. In order to detect patients who may be at risk for glaucoma, the optic nerve is inspected. On the left is a non-glaucomatous healthy optic nerve, where the center of the nerve is relatively small, which indicates that the nerve is not damaged and is healthy. On the right, you see a patient with referable glaucoma where the center of the nerve has been hollowed out. This is an exam finding called cupping and can sometimes indicate that a patient has glaucoma. We performed a retrospective analysis of the efficiency of this program, and we found that over the course of 2 years, between 2016 and 2018, our program screened over 51,000 patients. 817 were diagnosed with referable glaucoma, and 2/3 of these patients presented for in-office evaluations. We found that this referral program was very effective, where 1/4 of these patients who were evaluated were diagnosed with manifest glaucoma, many of whom already had advanced vision loss. This is our current workflow for detecting patients with referable glaucoma. A patient has an optic nerve photograph taken, and this photograph is evaluated by a LA County DHS optometrist. Then, based on the findings in the photo, the patient is either deemed to be referable glaucoma and sent for in-office exam, or deemed to be healthy where no exam is needed. However, there are limitations with this workflow. First, it takes sometimes up to a week before these optic nerve photographs can be evaluated, and there can also be a high degree of variability in the analysis of these photographs by optometrists. Therefore, we see an opportunity to implement AI interventions to address these limitations in the referable glaucoma detection workflow. We recently used data from LA County Department of Health Services to devise a convolutional network, which is a form of artificial intelligence. We trained this AI algorithm on over 13,000 images of patients who are either healthy or had referable glaucoma. As we trained the algorithm, it learned to identify referable glaucoma. And then we compared the performance of this algorithm to 11 experienced ophthalmologists or optometrists in their detection of referable glaucoma. The plot in the right, you can see, is something called a receiving operating characteristics curve, which plots the sensitivity versus 1 minus specificity. You can see that the performance of the algorithm, which is shown in the orange curve, exceeds or matches that of all of the human graders who are shown in the colored dots. This would suggest that by incorporating this AI algorithm into clinical workflows, we can provide expert level detection of referable glaucoma. Our evaluation of glaucoma patients is not based solely on fundus photographs. When patients present for in-office evaluations, they undergo a multimodal evaluation. And so in order to simulate this clinical experience, we have devised a multimodal computing platform that we call IAI. This computing platform can take in not only fundus photographs, but also patient demographic and clinical data, as well as testing data in the form of ocular imaging and visual field testing. This computing platform is very powerful as it is able to draw in data from various sources, including diagnostic devices, as well as electronic medical records. We recently published this computing platform, and we think of it as a foundation for the implementation of AI in clinical workflows. Looking ahead, we're excited to implement some of these strategies into improving the detection of glaucoma in the LA County DHS population. We believe that these types of tools will lead to a paradigm shift in AI-enhanced eye care. We can imagine that we can have point-of-care evaluation of these optic nerve photographs using an AI algorithm that is highly reproducible as well as equitable. And this AI algorithm can not only identify at-risk patients, but high-risk patients as well through more advanced training methods. Through this strategy, we can identify patients who have more urgent glaucoma and may be losing vision rapidly, and these patients can be referred more promptly for in-office evaluation so that they can receive treatment to avert permanent vision loss. We hope that this and other similar strategies can be used to deliver cutting-edge eye care for diverse populations, not just in the United States, but worldwide. I'd like to thank you very much for your attention today and acknowledge the hard work and contributions by all of the members of my lab. If you're interested in learning more, you can feel free to follow our research efforts on Twitter and X. Thank you.